Good evening to all my viewers on Heart Mitra. We welcome all of you who are going to join us live today for this conversation, and also those who would be joining us later on, and they will be watching this program on their Facebook or YouTube. It's always a pleasure to be talking to you and talking about the things which you want to know and topics related to your heart health. As you all know, that Heart Mitra is created for all of you, all the viewers, and we take up the topics here which you want to hear, you want to know. In the same context, today we have got Dr. Biju Govind from Hyderabad, and I'll welcome you, sir, to the program. Welcome. Uh, Not only we share on a daily basis information with you and we post content, but I think some of your questions which you post in the chat, it's important that we talk to you and bring in the senior experts who can answer your queries. And today we will be talking on an important topic which is around stress, and is there any relation between stress and the heart problems, and can it be managed? So we will be touching on that. But before I start taking your questions, let me formally introduce Dr. Biju Govind to you. He is one of the very popular cardiologists in the city of Hyderabad. After doing his initial graduation in medicine from Trivandrum, he did his master's in the medicine from Nagpur way back in 1997, and then proceeded for higher education and specialization in cardiology from Manipal Academy of Higher Education. And after that, since 2005, almost last 2 decades, he is serving his patients who are coming with the cardiac problems. He's also trained at the Asian Medical Center at Seoul, South Korea, in interventional cardiology. More than 15,000 angioplasties he has done in last 2 decades. And not only is a a popular doctor, but an avid academician also. And he's been teaching students. He's examiner of the DM exams, and he's also a trained certified person for medical education technology. And many research publications and awards are there to his credit. So we know that today we're talking to an expert who can answer all our queries on this topic. Let me, sir, straight away call you in and hand over the stage to you, and understand your opening thoughts and remarks on this topic, that what is stress and how this is related to cardiac problems. And after your opening comments, then we'll take in the questions.
Thank you, Mr. Sanjeev, for your kind words. And Heart Mitra, of course, is a wonderful forum for this sort of one-to-one chat. And of course, we entertain questions as well. So, welcome to all the viewers today evening and subsequent viewers who will be tuning to us in the coming days. As far as the topic of the day goes, it is an extremely important topic because stress is a part and parcel of modern day life. Unless you are a hermit sitting in the Himalayas and doing your meditation, all of us goes through stress. Now, the amount of stress each of us undergo and the way we cope with the stress we are exposed to varies from individual to individual. But it's a no-brainer that there is nobody who says I am free, I am stress-free, I am comfortable. That's very very unusual. Uh, it is a part and parcel of our modern day lifestyle. So, but is stress good? We will discuss it in greater detail, but stress could have some positive effects in the short term. But overall, if you see the overall health of an individual, stress is bad for the heart as well as other organs. But because I'm a cardiologist and I'll be dealing predominantly with cardiac questions, so I would say, as far as the heart is concerned, it is definitely not a good issue to deal with, and something which the patient quite often doesn't realize that he's exposed to so much stress. It adds up every day. It is not like it is not an acute one day event. It is a chronic event which adds up and it builds up in your body, and the effects are manifest after months to years. So it's important for us to know how it develops, how to cope with it, and how to prevent it from manifesting into various diseases in the body. I am not a certified psychiatrist or a psychologist to get into the nitty gritty, but as a doctor myself and having seen patients for more than 2.5 to 3 decades, I can confidently say that stress is not good for the heart.
Yeah. No, thank you, sir, for setting the context. Dr. Govind, we all know that cardiac problems happen because of certain risk factors, and they can be like, a family history would be there in the risk factors, bad cholesterol, hypertension, and there are smoking, and multiple risk factors are there. Now, can you help us understand that how big a risk factor is stress, out of all these, if we whatever I just shared. And secondly, if you can help us understand that what is the science behind that, how does the physiology work, and why stress will lead to a cardiac problem, for our viewers to generally get the understanding of this subject.
All right, I'll take your first question first. The first question was, um, how does stress fill in the risk factor list? When a person comes to us with heart disease, then you tend to say, like, how many cigarettes do you smoke? So you have a way of quantifying it, like the pack years of smoking. You can say, how long have you been a diabetic? How long have you been a blood pressure patient? So you have some ways to quantify it. How bad is your diabetes? You can look your A1C levels, the 3 month average sugar values, and say that, okay, you have a poorly controlled diabetes or a well controlled diabetes. But stress, you don't have a value to say, like, you have X degree of stress, your first degree stress, second degree stress. It's very difficult. You have got some. Um, Having said that, there is something called a stress scale. Like, it is used widely by psychologists and psychiatrists to deal with the problem. It's called a perceived stress scale. It's like a questionnaire which anybody can answer, you or me. And if I and you face the same level of stress, for example, I and Mr. Sanjeev, both of us are exposed to the same environment for the last 1 month, the answer to the questions on the stress scale would be different. So, what I mean to say is that the same amount of stress may have different implications for both of us. Implication in the sense health implications. So it all depends on how our mind and our body is tuned to accepting the stress. The second part of your question was, can you repeat that, Mr. Sanjay, once again? The
Yeah, the
second,
second part of the question was that, what's the actual physiological mechanism? We all
correct.
know
Yeah,
stress is bad, but what does it do inside the body which will lead to a heart problem?
yeah. So stress actually winds up a lot of hormones, bad hormones in the body, especially hormones like cortisol. So cortisol is a steroid hormone, which at higher, which significant levels can is not good for your body. It increases inflammatory level in the body. Inflammation is not infection. Inflammation is something which happens without infection. The body doesn't like inflammatory activity. Some of you who do your health checkups, you must have checked your CRP level sometimes. Many people come to me saying, my CRP is high. What is it? How to do with it? Now, CRP is one of the inflammatory markers. It only means that the body is unhappy with what's happening inside. The internal milieu is always undergoing churning. So CRP is one of the markers. So this chronic inflammation, presence of inflammation because of whatever reason, because of increased cortisol, for example, secondary to stress, will increase the plaque buildup. Plaque means cholesterol deposit buildup in the coronary arteries. So this, not only coronary, it can even build up in your arteries going to the brain. So this can produce various episodes like heart disease, stroke, all these things. So one direct mechanism how stress produces cardiac problem is by inflammation, chronic inflammation, increased cortisol, and um, plaque buildup in the arteries. Secondarily, people who are stressed tend to eat more. They do binge eating. They don't sleep enough because of stress. They don't get enough sleep. They tend to smoke. If they are a smoker, they tend to smoke more. They skip some medicines which they usually are supposed to take. For example, a person who is hypertensive and is very much stressed, he may skip a couple of days medication. So, or they may not. Who has been regularly exercising feel stressed, don't feel like the going for walking on a regular basis or jogging on a regular basis. So these are indirect ways how stress can help. All these things, increase smoking, overeating, binge eating, adequate lack of adequate sleep, not getting enough physical activity, skipping medications, all will contribute to bad heart health. So stress can have direct effect on the heart. It can increase your blood pressure and increase your heart. It can increase bad hormones in the body. It can also indirectly, due to various physical food, eating hygiene, and sleep hygiene, can also have a negative effect on the heart.
Okay. No, so I think Dr. Biju Govind here very, very clearly, highlights to us that Stress is definitely, one of the important risk factors for a cardiac disease. And then it is not just generally said, there is a science behind it. It's going to, impact some of the hormonal balance in the body, and because of which cardiac problems may arise. Or there are indirect reasons also that, because of stress, a person may start doing a few other things which can negatively impact the heart. So it is
Exactly.
a definitely thing which is an issue, and we must look at it. So I also would like to ask you. You will be seeing hundreds of patients, and in your practice you've seen thousands till now. So what are the important sources of stress, like to the patients who come to you? Is it work related stress? It is more a family or personal reason stress, or like what are the sources of stress which people accumulate and then they come to you, leading to some kind of a cardiac issue?
So, as a cardiologist, you generally tend to see these people only once they have developed a heart disease or they are on the threshold of manifesting a heart disease. But most of them would have traveled the stress path a long way before they reach to a cardiologist. So many of them would be picked up by the primary care physician or a psychologist or a psychiatrist. The good thing is our society is also changing, that people feel more often like they can meet a psychologist or a psychiatrist. That taboo of going to a psychiatrist has come down significantly, at least in the bigger cities. So that's a very good development which is happening. But to your pointed question, uh, we see all sorts of stress. A post procedure, like patient undergoes a major bypass surgery or a major stent procedure, patient has had a massive heart attack and barely survived through that. They undergo stresses due to physical stress, and of course about the burden of the family on them, especially if they are younger and they are the prime breadwinners of the family. Those stress adds up to it. So it's not that one um, it's not a straight jacketed answer to that question. It is different ways. I see most of the patients who come to the outpatient department, the stresses are different. Like their job stresses, they have plenty of night shifts, they don't get adequate sleep in the night. uh, they tend to smoke more, drink more, exercise less. So stresses related to financial problems, sometimes personal family problems. They have a relationship between a husband, wife, parents and children, that sort of disputes in the family. So all this adds up to this, and then when they come to me, usually some of them have blood pressures which are uncontrollably high, or blood sugars which are on the bad levels, and some of them would already have had signs of heart disease by the time they come. But as I told you, it is not a straight-jacketed answer, and the same amount of stress. Two people cope up entirely differently, as I told
Yeah,
earlier. I
yeah.
may undergo a heart surgery and come out and I start going for work the next week, but I've seen people who are finding it difficult to go back to work after 3 months, 6 months. So, uh,
Yeah.
so that's it all depends on individual to individual. It's not a
Yeah.
single one answer to that question.
No, no, sure. We do understand, sir. And as a cardiologist, I think you see the manifestation, especially in the cardiac disease, when patient has already undergone that journey. Sir, if I may learn from you, how do you guide your patients that, and especially younger population or the middle-aged population, that how do they identify the early warning signs of stress, which may eventually be leading to their cardiac problems? Are there any things which they should be looking out for? You earlier, I know that you mentioned about a questionnaire, or how this is quantified actually, that now I someone has some amount of stress, and what's the signal for him that okay, now he should be going and talking to his doctor about it and seeking help. So can you just help us understand this whole paradigm?
Yeah. So you're right. It is sometimes we don't even know that we are undergoing so much stress until it becomes too late in the uh, on the journey of the stress. So probably the initial things would be you are finding it very difficult to cope with your family commitments, family life. You tend to sleep more or less. It depends. It can go both ways. Some people who are depressed tend to sleep more as well, or you tend to eat more, like binge eating, as I already told, always feeling edgy, like you you get anger at very small things in the office. Your colleague makes a mistake, you tend to abuse too much, or you tend to pull away from people. You have a family, or you have a office meeting going on, everybody is coming, you don't feel like going there. You say, okay, that's a waste of time, or you generally don't feel a lack, you feel a lack of energy to participate in healthy debates, attend group meetings, attend parties and weekend programs. So those sort of signs, when you feel like being withdrawn, at the same time you don't have the energy levels, that's probably the first signs that your stress is building up. So the idea is to find out what is the source and then how to work around it. That is where the help of a doctor comes in.
Okay. No, I think these are some very, very specific things which you have shared. If you're having sleep issues, you're getting short-tempered, angry too often, or having withdrawal symptoms, you don't want to participate in discussions with colleagues or with family, having some isolation-related issues, or feeling low on energy. So, these are the signs that something may not be very good inside, and you may be getting some stress symptoms. And I think this is how you quantify as well. Talk to your doctor, talk to yourself, and try to find a solution to these things. Because if you don't manage these things, then probably this may lead to certain diseases, including the cardiac disease as well. So now, as you mentioned, these days it's not a taboo. People don't. There are psychologists available, and people go and talk about this, and find out a solution to it. Now, at times they find their own solutions as well. And you talked about binge eating and all, especially in the younger population today. And we know that cardiac issues are coming more often in the younger population. They feel that it's important for them to break loose on the weekends. You 5 day, you take all the stress of the work, and then on Saturday, Sunday, you go for those OTTs, binge watching of television or binge eating and cheat days to relieve stress. From as an expert, we want to know from you that does these things, do they really relieve stress, or do they add on to the stress burden?
Okay. See, anything bingeful is not good. Definitely, you don't get relief by. When I say attend parties, doesn't mean to. I'm not encouraging that binge eating habits or smoking, because those habits, you don't actually have 2 days of cheat days and the rest you are healthy and live. That doesn't work. There is a specific psychological condition called bulimia, where actually you tend to eat a lot, and then they repent it, and then they tend to exercise more to compensate for that, or even induce vomiting themselves to take out that extra food they have eaten. That is a specific psychological condition called bulimia. But binge eating is different from bulimia. Binge eating, in fact, is unhealthy, and quite often they don't feel that it is something wrong to eat like that. They feel okay. They worked hard for a week, and it's their due, or they deserve to be treated. Yes, of course, you deserve to have a weekend break, no doubt about it. But anything in excess, let it be food, let it be your cigarettes, or let it be alcohol, I don't approve or I don't recommend binge eating in any way. um, Stress relief doesn't happen overnight. It doesn't happen by a weekend of binge eating. Stress relief is something which you have to incorporate into your day-to-day practice, so that the stress doesn't affect you hereafter. So the stress should be kept away from you. By binge eating or smoking, you probably will go more stressed the ensuing week rather than relieving yourself. Having said that, always stress. The other question is actually, the other day, one of my colleagues, actually, who was a junior colleague, we were having a small chat. So we had a small discussion on good stress and bad stress. Now this is an interesting term discussion we had the other day. There does You must be wondering, actually, Sanjeev, and all the viewers, there is something called a good stress. That is a very short term stress which actually can drive you to achieve more. Like, for example, you have a big presentation coming up or a big exam coming up. You take the stress of that. It is a short term. It will enhance your performance. You will do better. So they are very short term stresses. That is called eustress or a good stress. But that is not the topic of the discussion here, because we are talking about chronic bad stress. So you have to binge eating is not the way to avoid bad stress. The way to avoid bad stress is to eliminate stressful things and stressful events and stressful people from your life as much as possible. Now, of course, this doesn't mean that if you have a problem in your home, you leave the home and go away. That's not the situation here. For example, if you have a colleague who is always at your neck and this thing, you just ignore his or her um, comments or her presence. Some things you have to learn to accept as it is. So because you can't change everything, and we can change only very little things around us, forget about the world. So some things you have to accept. Okay, this guy is like that, I'm not going to change, and I'm not going to feel stressed because he's like that. So that is only going to give me more stress. So some things you have to uh, accept as things are. You have to start thinking more positively. If you have a good diet, good sleep. Now, I can tell you any number of times that adequate sleep, there is nothing a big de-stressor than adequate sleep of 7 to 8 hours a day, depending on how long you feel refreshed. Like a person like me feel refreshed after 8 hours of sleep, but there are people who gets equally refreshed with 5 hours of sleep. So you have to find out what's your sweet spot and go accordingly. Other things like, say, you have to get your support whenever you feel like getting support. Like, you don't hesitate to go to your friends, colleagues who you can rely upon. And if you think that things are beyond um, them, you can seek professional help as well. Relaxation techniques, which briefly Mrs. Sanjeev also alluded to, like deep breathing exercises, meditation, yoga, all works wonderfully well. And there are plenty of doctors recommending and doing themselves and encouraging their family members also to pick up these practices, age old practices in our tradition.
Yeah. No, no, thank you for highlighting this. Sir, we'll come specifically now, more to patients who are undergoing cardiology problems. Now, let's take a real-time example of a patient of yours, like who's a middle-aged person, let's say anything between 40 to 50 years old, is having some hypertension, is having some high cholesterol, and little bit of, let's say, some family history as well, and no event has happened. So how do you guide this patient to manage his stress level so that stress doesn't become a precipitating factor to further worsen his disease and he goes towards an event? So what's your guidance to such patients? What kind of changes they can bring in their lifestyle and how do they manage it?
See, somebody who has heart disease history, he already is much higher risk than a person who does not have. So that means that the ground is already there. So it's very important to see to it that you don't sow any seeds of disease on that fertile ground, which is your bad genetic background, which you already have, which you are born with, and you cannot change. So controlling hypertension, controlling diabetes, those becomes the basic norms, which there is no question, and it has been proven um, time and again that uncontrolled hypertension, uncontrolled diabetes will definitely add up to your heart disease risk. Stress adds up to all these things. So this doesn't work like one plus one plus one. It usually works into one into two into four sometimes, and it works differently in different people. So you can't say that you have hypertension, diabetes, and you have stress, you are definitely likely to have heart disease. That may not be the case, but definitely stress will increase your hypertension. So stress will increase your diabetes level, and stress will directly affect your heart as well. So stress can work in multiple ways on your body systems. Those things which we already discussed in the beginning of the conversation, like building up your cortisol levels, which are bad hormones, which will drive up the inflammatory markers, and stress directly increasing hypertension. We all know that if you are stressed up, your BP goes up. So every spike in hypertension, every spike will have an effect on the long run. So the more time in the day your blood pressure remains above that satisfactory window, 130, 80, whichever your doctor has set up for you, each time it crosses, it adds slow, the seed grows a little bit. So the stress is definitely going to fix it all. So for that matter, we all recommend to all people to as I already told, how to avoid bad stress. So taking out all the things which you think is deriving your stress and taking professional help when required.
Okay, so I think what he re-emphasizes is that all these things will get precipitated because of stress. So manage them, and some combative strategies also Dr. Govind has highlighted. But anything, sir, specific you recommend your patients in their in their lifestyle, or how, or what can be manageable, or let's say in the preview of a cardiologist, like how do you guide them from your own end, that basic lifestyle changes which they need to do.
Okay. One of the important problems which doctors face in the current this thing is the lack of time which the doctor spends with the patient. It is not nobody's mistake actually. Patients are also very busy. They want to get a fast food solution to their problems, and the doctor is also busy. So it is a problem of both sides. But having said that, to combat stress, the most important thing is to identify the cause, and you better write it down like this is the biggest stressor for me and how to eliminate it. Everything cannot be eliminated. For example, you have a stressful job environment, you can't eliminate it entirely, but at least you can see how to work around it, to take help probably from your colleagues or from your superiors, whoever you think is understanding your situation, and take and take steps to identify the cause. You always list the commitments you have. So when you have an issue, you see what are your commitments, you assess your priorities, and then non-essential things which are coming in the list, you eliminate it. Some of the times the stress is added up because you have essential things which you can't avoid. For example, your children's education, their marriage, their issues, your work related issues, and there may be smaller things which are very small things. But when all these things come together, our mind has a limited capacity. It may not be able to take. So you assess your list your commitments, assess your priorities, and eliminate what is you think are not the most important ones in that list. Strong relationship in the family, in your workspace, in the society, with your friends definitely helps you as a stress buster. So somebody to open up yourself. So a strong relationship. Whenever you're angry in a situation, just walk away from that. Count to 10. Don't give an answer. You just wait. Do never give an answer. This thing. So these are, you feel the situation is beyond what you would be able to handle. Just move away from the situation. Exercise regularly. Exercise builds up happy hormones, endorphins. So they are mood boosters. They will decrease your stress levels. So regular exercise, people. One way of stress busting, easy way, is regular exercising. You avoid excessive caffeine, avoid smoking, give enough rest, which we already discussed. As much sleep as you think refreshes you. So these are all vague. They're not vague. I'm sorry. They are very specific, but they are all generalized comments, which as a doctor I can think about and I can tell
Yeah,
you.
yeah.
As a cardiologist, I would want my
So,
patient to
mhm.
take adequate rest and take all their medications and trust your doctor. And it's a good practice for that's for me as a doctor as well, to educate the people, especially the sick patients when they're leaving the hospital. It's a good thing for a psychological counselor also to have a pep talk with them to boost their morale.
No, no, I think I must thank you, Dr. Govind here. Look, we are talking to an expert today who's an expert in doing complex cardiac procedures. But end of the day, we all know that cardiologists, they receive their patients, and these problems these patients pick up because of a lot of background reasons, and stress is one of the major issues, as you highlighted. And I think here we have such a senior person who's trying to help our viewers understand that how they can actually manage the basic precipitating factors, so that they don't pick up the heart disease, or they don't the heart disease doesn't worsen. I must thank you, Dr. Vijay Govind, for doing this. Just one last question, sir, I will ask you, and this is on those patients who have already they have had a heart attack. Now either they have gone a bypass surgery, or they have undergone a cardiac stenting. Now, as a doctor, once you do a procedure, done a cardiac stenting, you have probably already made a patient normal, and he should be on the path of recovery. But in the mind, a patient takes a lot of stress that, oh my God, like something big has happened. I've suffered a heart attack. Been in the hospital. I've undergone a procedure. So I want to know from you, sir, that is it a valid reason for someone to really take a stress, because you are trying to bring him out of the situation, and he is feeling stressed out that he has undergone a big procedure. So first question is that, is it a valid reason for him to feel stressed? And then how do you guide such patients that they should limit their stress factors and be on a faster path to recovery?
This is a extremely good question and a very good point. Uh, I won't mince my words here. A heart disease patient is a heart disease patient for life. That is, let's not beat around that. You have a heart stent or you underwent a heart surgery, you are a patient for life. But is that bad? Sometimes no. In fact, there is even a book written. I forgot the author, but I remember reading this book about 15 years ago. It is written by not a doctor. It is written. The book was titled. You can probably check up in your Google sites there. A heart disease, a heart attack can save your life. That is the title of the book, and it cannot be more truer than that. You have a heart attack and you survived it, you thank God that you survived it, because most of the deaths during heart attack occurs in the first 1 hour when medical help is maybe unavailable in most parts of our country. So you have survived the disease itself means that God has been with you throughout. And with treatment, with whatever stenting surgery what you undergone and with all the medications that you are on, you are definitely on path to recovery. By stenting and surgery, we are not reversing the disease process which is already going on in your body, but we can always control the processes from worsening further. The diseased area is taken care of by stent, but we can always do much, much more to prevent disease from developing in newer places in the heart. And for that, medications, your doctor's advice, regular healthy lifestyle, and de-stressing will help.
Okay, so I think that's here you hear from from an expert. So you have a disease, but then don't feel stressed out. I think you are on a
Yes,
path to
absolutely.
recovery, and you should be feeling confident that your doctors have done best to make you come out of that situation, a difficult
Uh,
situation
uh,
which you
um,
faced.
One final parting word to just as a confidence, a morale booster for all. Uh, Heart disease patients, we see them surviving 30, 40 years after heart attack. It's not that there is some misconcept in the society that second attack you will die, third attack you will die. So you end up waiting for your second episode, second attack. That's not the case. You can have three attacks and still survive number one. God forbid it happens. But be assured that with medications, with the current era of medications, your doctor is well positioned and is well armed to save you from such dangers. Just don't be complacent. Listen to your doctor, do your regular exercises, and take your medications. A long, healthy life is assured.
Yeah, so I think on those positive words and reassuring comments from Dr. Biju, I think we come towards the conclusion of the program. And he has, to begin with, very clearly shared with us that yes, stress is one of the important risk factors for a cardiac disease, and people should be cognizant of that. And but then don't worry about it, that stress itself becomes a problem for you. Uh, Learn and identify what are the reasons because of which you may be picking up the stress. Remove those from your life. And he talked about the combative strategies as well, that how do we make changes in our lifestyle and combat as well this stress. And finally, if you have undergone a procedure, then don't take a stress of that procedure itself. You are on a path to recovery. Yes, you have a heart disease. You need to be careful, but I mean, don't take undue stress because of that, which may be unduly leading to other problems. I think, sir, let me thank you here. This has been a wonderful conversation, and you have been very kind to answer all these, questions, knowing your expertise, but you still took all these basic questions as well for the benefit
Thank
of
you.
our viewers. But before I conclude, sir, and thank my audiences, I'll give it back to you in case you like to emphasize anything which we have missed out, or would like to give your summary comments.
I think we have discussed what all we could discuss in such a short period, but stress is, as the opening remarks which we had, stress is an unavoidable part of our modern day life. And it's all the way you cope up with the stress that matters. if you have try to build up good, healthy relationship in your family and in the society. Uh, Eat well, sleep well, do definitely practice practices like yoga, meditation, deep breathing exercises. These are all now proven. Even if we don't have enough proof, even we have western proof data available, how this will help the heart and body health, mental health as such. So I wish all the viewers a wonderful and healthy life ahead. And I thank Mr. Sanjeev and Heart Mitra for giving me the opportunity to interact with such a large audience in the virtual world. Thank you.
Thank you, Dr. Govind, for all your expert views. So, to our viewers, we thank you for joining in today and later on as well, people who would be watching us. In case you want more advice on this subject, or if you have cardiac issues and you want more advice or expert opinion, you can meet Dr. Biju Govind. He's interventional cardiologist at Shri Shri Holistic Hospital at Hyderabad. If you are in Hyderabad, Telangana, Andhra Pradesh, I think you can easily go and meet him. In case you are in any other city and still, watching and listening to his thoughts, so whenever you pick up those stress signals, go and talk to your doctor immediately. Don't ignore that. So with this, we thank everyone. Dr. Biju Govind, we thank you as well
Thank you.
for joining us. Have a great time and good night, everyone.